Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith Rogers. Today, a different perspective on trust. Dr. Sara Gorman is a public health researcher and author of a new book called The Anatomy of Deception: Conspiracy Theories, Distrust, and Public Health in America. She talks with Dr. Josh Sharfstein about her perspective of why trust in healthcare has been falling and why conspiracy theories have been spreading. Spoiler alert, it's not the usual conversation we've been having in public health. Let's listen.
Dr. Sara Gorman, thank you so much for joining me today in Public Health on Call to talk about trust in the healthcare system and your new book. Now, trust in the healthcare system has been a big topic since the pandemic. A lot of articles written about it, a lot of meetings about it, a lot of concern, appropriate concern as the surveys come back showing that people are not trusting the medical system and turning to all kinds of alternative ideas without evidence. What's the typical conversation that's going on about what this issue is involving?
Sure. The typical conversation tends to focus on why have people lost trust in the healthcare system? What has happened to them that has caused them to lose their trust? And what can be done to help them regain it through better interaction with healthcare providers? So it really focuses on the individual interpersonal interaction with healthcare providers in the healthcare system and how to increase the trust-building conversation in those settings particularly.
So someone might interview someone who has turned to YouTube videos and decided never to go see a doctor again and ask them, what was your relationship with your doctor like? Something very narrowly focused.
Exactly. And even a lot of the research on trust focuses on people's trust in doctors specifically. So a lot of the polls you'll see on trust in the healthcare system have almost exclusively questions about trust in doctors and other medical professionals.
So if you conceptualize the problem as trust on a one-on-one basis, then all your solutions tend to be about things that can be done on a one-on-one basis.
Right. And so it really focuses on conversations that can happen in the healthcare setting, one-on-one and interpersonal setting that can build trust versus system-level interventions.
System-level interventions. So now let's talk about your book. You take on trust from a totally different perspective.
Yes. So instead of asking the question, why have people lost trust in the healthcare system? I ask the question, what has the healthcare system done to make people lose trust in it? So it actually becomes a question of trustworthiness instead of trust. And when you do that, then you're looking at things on really a structural level. When you're figuring out what to do about it, it becomes a much more systemic level intervention versus a one-on-one interpersonal intervention.
That's a big idea. So let's break that down a little bit. When you say trustworthiness, what are components of trustworthiness for an entire system?
Trustworthiness would be somebody's ability to trust in a system. So it would be their sense that the system is benevolent, that it's compassionate, that it has their best interest in mind. That's the most important thing, that they feel that the system has their best interest in mind. When there are surveys done on trust, that's the most common question asked, whether they think that, for example, doctors or health systems have their best interest in mind.
What does a system do to push people away so that they don't think that it has their best interest in mind? Like, what has then responsible for a loss of trustworthiness?
The biggest factor I identified in my book, and this was through over 70 interviews with people who self-proclaimed as having lost trust in the healthcare system, is a loss of access to the healthcare system. So what I really found was that a lack of access to the healthcare system drove the distrust. And healthcare systems do a lot of things to push people away. And one of the biggest things we're hearing about lately is medical debt. That is a big burden for many people in this country. It's the biggest debt burden of any other kind of debt burden. And when people, even people who don't have medical debt, see that there are so many people saddled by medical debt, they come to believe that the medical system doesn't have their best interests in mind, that it's after them for money, that they have a profit motive, and they lose trust in that system.
Dr. Gorman, would it be possible to give an example of how this kind of experience of troubled access or difficult access to healthcare can take someone from trusting the healthcare system to not trusting the healthcare system?
So there was a very interesting case that I interviewed in my book. This was a woman who lived in rural Montana. For her whole life, she grew up there with very little access to healthcare. And during her entire life, she didn't trust the healthcare system. She used a lot of alternative medicine, and she didn't really seek out medical care when she was sick. And then she got married and moved to Norway, where she had excellent access to healthcare. And she started to realize that she trusted the healthcare system, that she sought out the healthcare that she needed, and she stopped seeking out alternative treatments. And then she actually moved back to Montana and went back into the system where she had a lot less access and went back to her old ways, and even started during the COVID pandemic to believe in conspiracy theories. And she actually did say to me, why would I trust a system that I don't have access to? So that was a very stark example of how the access issue can affect people's trust in the system.
Let me ask you this. Do you think that the sources of misinformation or disinformation out there are kind of playing on this issue of lack of access in order to attract people to alternatives or conspiracies?
Yes, I do. And I think a lot of the alternative medicine world, which is tied into the misinformation and disinformation world, plays on this lack of access. Those parties definitely talk about how you're not going to get treatment otherwise, or you're not going to get good treatment otherwise. This is a much easier way. They talk about how much easier it is to access this treatment. They really emphasize that. And so they are preying on the low trust that comes as a result of the low access.
What kind of evidence is there that as access problems increase, trust goes down?
There's definitely evidence that insurance status is associated with trust. So people who have better insurance have higher trust in the healthcare system. And same thing with people who self-report poor access or worrying about medical costs and seeking medical care, report lower trust in the healthcare system. So we see associations of those things in the literature for sure. And then, of course, I found it through my qualitative work as well.
I want to talk about solutions. This is I think, an interesting diagnosis and very persuasive one that you have in your book, frankly. That you're basically saying that when we have a broken healthcare system and people struggle to get the care they need, then they're going to be frustrated and lose trust. I think there's some very clear logic to that. I wonder what that means for those healthcare professionals who are doing their best in this system. We'll turn to the system changes in a second. But for people who are struggling right now with their patients, not trusting them or turning to all, conspiracies, what are the implications for them?
I think that, first of all, physicians and other healthcare professionals need to be involved with improving access to care. I think a lot of times they think it's not really their lane to be involved in social change and policy change, but it really is, because, as I show in the book, institutional and interpersonal trust are intimately intertwined. And so they affect each other. And so if people don't trust the healthcare system, they're not going to trust their doctor either, and vice versa. So they do have a role to play in convincing their professional associations to be more involved in lobbying for changes that will improve access to care. They also can work directly with patients to talk to them about the difficult information environment that exists out there. There's a huge interplay between misinformation and mistrust. And so to the extent that doctors can talk to people about what kind of information they're seeking out about health on the internet, what they're seeing, even do short forms of motivational interviewing and pre-bunking and debunking. There are short ways to do that, even within a short visit in the medical setting. I think that can go a long way in building trust. And it also shows the patient that the doctor cares about what they learn about the medical system, about what they understand, and to make sure that they take the time to really make sure that they can understand the system and the information about it.
I wonder if one of the implications is that doctors, nurses, other health professionals should be attuned to the access problems that their patients are having and maybe even ask about them so that they can appreciate those alongside questions that might be coming in from left field.
Yes, I think even asking questions about how worried are you about being able to access this care, and are you able to pay for this, and do you know what your responsibility is going to be? Do you need help navigating that? Those kinds of questions can show that the provider cares about these issues. That can go a long way. I think you remember I may have said before that having the best interest in mind of the patient is a huge part of trust. And so asking those kinds of questions shows a kind of compassion that indicates that the physician or the other healthcare professional has the best interest of the patient in mind.
So at a minimum, kind of aligning yourself with the patient against the frustrations of the healthcare system, recognizing that it's still the failures of the healthcare system that may be fueling this
Exactly.
distrust.
And I think sometimes patients get blamed for not trusting the healthcare system, like it's sort of their fault that they don't have the trust and they need to regain it themselves. And so if the doctor recognizes that there's a system out there that's making it hard for them to trust, and they really recognize that, then there becomes an understanding between the patient and the doctor that builds trust.
So interesting. Okay, let's turn to this systematic changes. What do we need to do in policy to push back against this access challenge that, as you argue in your book, is making it harder to trust?
Well, there's good news and bad news. The good news is that anything that builds access will build trust. The bad news is that it's hard to build better access to the healthcare system because there's a lot of political resistance to that. So there are some things that can be done that aren't a complete overhaul and, proposing universal healthcare, which is very hard to pass in this country. For example, I've been very heartened lately by the efforts of the AMA and Congress to clamp down on prior authorization, because that brings better access to medication for patients. And I think that they may have some success with that. And that is a good signal to people that the medical system cares about their access to medication. There's also a movement right now with the FTC about PBMs, pharmacy benefit managers, and trying to, and they've been really driving up the cost of a lot of drugs. So trying to tamp down on that as well has been a movement that has been happening lately. And, things like that can really help. They're smaller scale. They're not an overhaul of the healthcare system, but they are movements in the policy realm to make healthcare more accessible. Anything that funds prevention, gives more funding to the CDC and local health departments, can be very effective in showing that we care about overall health and well-being. And then there are smaller things we can do, like funding more of children's health care. A lot of people are very stressed out by paying for their children's health care. And we're one of the only countries that doesn't cover children's health care at a complete rate. So covering more of children's health care, funding school-based clinics, these are some of the things that can both signal that we care about access and actually improve access, which in turn improves trust.
There are a number of places that are trying to reduce medical debt, either buying medical debt outright or providing requirements for hospitals, for example, not to charge patients at low income. Do you think this is a promising direction, or do you think it's maybe too little, too late, given how much debt there is?
No, I think this is a good direction. Of course, we want to cut down on the debt that's incurred in the first place, prevent versus fix it on the other side. That would be ideal. But I think given the system that we're in and what I was just talking about making incremental changes, it's a very good movement in the right direction. And it both signals to people that we care about them and we care about their access to the healthcare system and their ability to get medical care. And it also relieves their debt and their despair over getting medical care.
That's a really important combination. I'm struck by this, and tell me if you think this is just being pessimistic, that there's a bit of a vicious circle, that when there's less access to the healthcare system, people may distrust it, may turn away from it, may decide that there's an internet guru they should be following down a path instead of getting treatments that are more effective. But as they do that, they may become disengaged from the political process. And the very people who could most benefit from greater access to care may not be that interested anymore because they're so distrustful of the system. And so you get a vicious cycle where you don't get the political change you want, and you get more people distrustful, and they drop out of the political advocacy world, and it just gets worse and worse and worse. What do you think? I'm a pessimist sometimes.
Yeah,
to be
that's
honest
a hard
with you.
question. I think this is where organizations like local news come in to bind people together. There's a big connection between community organization and trust in any institution. That's not just healthcare, but also the government, education, any institution you can think of. I think we really need to invest in local community-based organizations, local community-based news, anything that brings people together in communities, because that's really where social change happens. Even if people start to become disenfranchised, there's a greater chance that they'll be pulled back into a social change movement if they're connected in the community.
So in a way, countervailing that vicious cycle is a potential virtuous cycle if we get more people involved at the local level, more people aware about the access problems and working to improve them. And the more success they get, maybe that starts to build trust and brings more people in to work on that.
Exactly.
All right, that's what I'm going to be hoping for. Thank you very much. I think your book is really interesting and important. I think it reframes the conversation on trust, that it is certainly about individual interactions, and there's all kinds of literature about that, but that it is not just about those, and that we can do things together to lift the trust boat for the whole country.
Thank you. I appreciate you having me on.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production management by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Eliza Rosen. If you have questions or ideas for us, please send us an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.